everybody, Dr. Jordan here, Dr. Andrew with Mouw Family Chiropractic. We're here for our second component of our Body Signals Workshop series. So we're so glad that you're joining us. This time we're going to deep dive into sleeping issues. So we're so excited to talk about this. I think if there's one area where there's a little bit of a chink in our wellness armor, it's probably this area. And I'll also add that this is probably the area that most people underestimate when it comes to their sleep. A lot of times we know how to eat healthy and we think about that. Maybe we're not doing it, but we know that we should eat healthy. We also know that we should get good exercise on a regular basis. But if there's an area that people underestimate when it comes to their overall health, sleep is the area that we probably most commonly see with that. And so we're excited to share that with you. There's really three components to this workshop that we're going to do. So part one, we're just going to talk about the overriding narrative of what we notice when it comes to sleep issues. The chronic social stress, some of those components as well. And then we're going to dive in clinically and talk about probably the three most common issues that we see when it comes to sleep. So things like number one, sleep apnea. We're also going to talk about thoracic outlet syndrome, and then we'll talk about restless leg syndrome. And then at the very end, we're going to talk about the most frequently asked questions that we get around sleep. So things like, what type of mattress should I be using? What type of pillow should I be using? My body only needs about 5 hours of sleep. So we're going to talk about some of those things and just some of the frequently asked questions. So before we dive in, just a quick reminder, if you haven't watched the introductory video on body signals, make sure you watch that first. That'll give you a little bit of insight into what is body signals, why do we phrase it as body signals. It also teaches you the overriding narrative that is, sleep issues aren't necessarily the issue. The issue is a more overriding, underlying issue that's driving that problem and that process moving forward. So if you haven't watched the Body Signals introductory video, make sure you go back and watch that before you move forward with this video. Cool? So I want to start with just 5 ground rules. These are things that in our office, these are things we teach our patients. These are kind of ground rule principles, so to speak, on what we want our patients to understand as we're taking care of them in our office. Okay, so number one is that you're designed to be healthy. That for 99.6% of us, if you put your body in the right environment consistently over time, the natural expression of your body is to express health. And conversely, if you don't do those things that are absolutely required of your body, it's going to break down over time, right? And so there's 2 things that really break down our body over time. And there's 2 categories. So the first one is deficiency. Your body's not getting something that it should be getting. Okay, a perfect example of this is something like omega-3s. Okay, that's a supplement that we recommend in the office because for us who live in the Midwest, we're not getting enough healthy fats in our diet. And so that's a perfect example of something that's deficient. But also toxicity, and I would say toxicity is probably the biggest one. For instance, pop. Okay, pop is an example of a toxic substance that adds no nutritional value, right? And there's a lot of toxic things that are in pop. So toxicity and deficiency is what drives us away from health, but if you do the right things to your body over time, it's designed to express health. Number 2 is that you are intelligent. I love this concept because I think a lot of people when they come into our office, at least initially, is that their body's breaking down and they totally forget that, hey, my natural tendency is that my body's intelligent and it's designed to be healthy. And so there was 2 cells, a sperm and an egg, that came together, and in 270 days it created you, right? What have you done in 270 days? So it's pretty cool is that your body has an intelligence within it, and every cell, organ, and tissue system is that it's intelligent, and that over time, if you do the right things, your body is going to express that health. Number 3 is that your nervous system is your master system. Your nervous system is what that intelligence courses across. And so the nervous system is king. And so when we talk about chiropractic care, a lot of people think about the spine and the joints and so forth, but one of the things we always come back to is that it's all about nervous system health. If your nervous system is expressing health, you're going to be healthy, okay? And your spine is your lifeline. We teach our patients that your spine is your suit of armor. Okay, it's what you go out into your daily life, and your spine is what helps you move and it helps you function. Okay, it's your lifeline and it protects the very delicate nerve system. And very lastly, this is my favorite one. If you keep doing what you've been doing, you'll keep getting what you've been getting. Okay, how true is that for us? That if you keep doing the things that have driven you away from health, guess what's going to happen? You're going to be unhealthy. But if you change your course and you change your path moving forward and you say, hey, I'm going to take this different route and I'm going to become healthier and I'm going to make a transformation, that you're going to get different results. And we see that every day with our patients, and that's the fun part. So that's the 5 ground rules, okay? When it comes to sleep, it literally comes down to this overriding narrative, and that is that we live completely unnaturally of what our body expects of us. Okay? And what I mean by that is we have somewhere in the neighborhood of 2,000 to 3,000 generations that have come before us, right? And each one of them was successful. Why? Because they used their surrounding and their body told them and expressed them as a guide, right? There was a guide that they listened to as we move forward. The problem is that our modern lifestyle has driven us so far away from a natural lifestyle that we start to express chronic issues. That's why we're seeing more heart disease, more type 2 diabetes, chronic issues in kids. The reason for that is because of this unnatural living. Right? What I mean by that is when you look at nutritionally, we're not only eating different quality of foods, but we're eating at way different times. We're eating, until 8 o'clock, 9 o'clock at night. We're having supper or a before bed snack, okay? Number 2 is when you look at our exercise. We have literally engineered exercise out of our daily routines. So rather than just hunting and foraging and for food, our ancestors, they'd actually go out and exercise, right? They didn't think like, oh, I need to get a workout in today, right? Because what they did every day was they worked out as part of their daily activity. Well, now we need to start looking at exercise as an important nutrient. It's a supplement that you need to get every single day. And the rule in our office is you only exercise on the day that you eat. Okay, so if you eat that day, you need to do some sort of exercise. Okay, and the other thing about that is our sleep patterns are so unnatural, and we're going to be diving into that today. But the overriding narrative is that we need to get back to a normal cycle in order to resolve the sleep issues.
Yeah, so a big player in this is something we call cortisol. And so cortisol is a stress hormone, and so most people, when they think of a stress hormone, they think of something bad. But cortisol is really great, and it needs to have natural presence in our lives. It cycles up and down every day, and if it's cycling up and down really well, then we're going to be healthy. If there's abnormal cortisol levels and that changes, then that's going to create sickness. And so cortisol is a good thing, but too much or too little cortisol is when it becomes a bad thing. And based on our lifestyle, the choices that we're making, the rhythms that we have, are really going to impact whether cortisol is in a good spot or not. Also, you think about circadian rhythm, and you think about just the light of day influences your hormone levels and your ability to sleep. And a lot of times, like Dr. Jordan was mentioning, when our ancestors, back in the day, what did they do? What was their sleep regulated? It was regulated by the light. And as we look at our physiology, we can see that our hormone levels, our ability to sleep at night is hugely impacted by the light. And so what our ancestors did is when it got dark, what did they do? They went to bed. There was no light. You couldn't do anything more, right? But what are we doing today is we have houses, we have artificial lighting, right? We're trying to crank out, more out of each day, and we extend that day as long as we can, get more done, right? Do more. And that's totally messing up the hormone balance and our circadian rhythm and our physiology, and therefore creating sleep problems. And so we really got to pay attention to this in our body. It's a real thing. And so this is kind of how that's supposed to work out as you watch just the body's physiology and how it changes through the hours of the day, how your hormone balance will change through the hour of the day. So say we wake up at 6:45. We typically see a change in blood pressure. That's when blood pressure tends to rise. That's when melatonin at 7:30 starts to stop. So melatonin, if you guys don't know, is a sleep hormone. It's a hormone that helps your body sleep. And so melatonin will change throughout the day if we're in a healthy spot. And at this time, melatonin is decreasing, so we can wake up, right? And then you get to 10 a.m. and you have your highest level of alertness. And so this is kind of a cool thought. If you really need to be doing some thinking, some creative work, some really work that takes a lot of mental capacity, you want to do it like in the early morning or like mid-morning, because that's when you're going to be most alert. And we get to noon, and we get back into the afternoon, 2:30. Typically, we have our best responsiveness in terms of our coordination, our movement there. 3:30, fastest reaction time. That's kind of interesting to look at. 5 o'clock, greatest cardiovascular efficiency and muscle strength. So I do like to work out later in the day if I can, or maybe like in the right before lunch. That's kind of my favorite spot because my physiology is different in those parts of the day than it is in other times. And so we definitely see this with our physiology. It's always going on whether we're aware of this or not. And so the more we line up with the cycles that are already going on, the healthier we're going to be, the better we're going to be able to sleep. When we get into 6 p.m., 6:30, we actually have the highest blood pressure. 7 o'clock, our body temperature will rise and to get us ready to sleep. And then 9 o'clock, we have that melatonin starting to come on and help us to fall asleep. And just a side note here, basically 10:30 to about 2:30, late night, early morning is your best, most productive time to get non-REM sleep. And so that's just, and the more time that you can get in those hours, the more refreshed you're going to be and the better sleep you're going to have. So if you're waiting until midnight, 1 o'clock to go to bed, you're missing out on that really great opportunity, that great window there. So that's kind of how our body naturally goes through its physiology through the day. And then I mentioned cortisol, but this is just kind of a map of how cortisol should look as we go through the day. So say we start the day, in the morning, our cortisol levels are actually naturally highest in the morning to help us to get ready for the day, to amp up our body to attack the day. And then if we're in a healthy spot, naturally that level will drop as we go through the day to the point where when we're ready to sleep, cortisol should be low, right? Cortisol helps us to deal with the stresses of the day. We want that to help us to amp our body up and deal with those stresses, but we also want that to come down at the end of the day so we can relax, so we can shut off, so we can start to repair. And so if cortisol is following this natural, elevate in the early day and drop, we're going to be healthy and we're going to be sleeping really well. And unfortunately, this is not what a lot of our cortisol profiles look like.
Yeah, for most of us, literally through 6, 7 o'clock at night, it maintains really, really high.
Yeah.
Right? And that's the unnatural living aspect that we're getting at, is that our cortisol levels are staying so high during the day. For most of you, if we tested your cortisol levels, we would notice that there's a rise consistently throughout the day, and that maybe you drop off a little bit as you go to sleep, but most of us our mind keeps going, right? Even though physically we're not tired, our mind keeps going, and so what happens is this cortisol level stays really, really high.
And that circadian rhythm we talked about, that can throw cortisol off. The exposure to light and our activity levels, not respecting our physiology and what's going on, that will all throw our cortisol levels off. Yeah.
So when we have chronically elevated cortisol, there's a few different things that drive that. Okay, so what does cause this elevated cortisol? It's probably the question that's going through your mind. Well, there's a few things. Number one is limited exertion. So we're not exhausting our body. We're not physically exhausted. So like I just mentioned, most of us during the night, we wake up at night because number one, we're not physically exhausted. So your body physiologically is like, well, I'm not tired, so you wake up. And then your mind starts going, and then you're up for 2 or 3 hours or 45 minutes because you can't get back to sleep because your mind's going. So there's limited exertion, there's chronic psychological stress, just what I spoke about there, and sleep deprivation. So you start to lose sleep. And this is what we call the 1, 2, 3 punch of elevated cortisol levels. Okay.
And so a lot of times when we feel tired at the end of the day, it's not that we're physically drained. It's that you're emotionally and psychologically drained, right? That if you think about most Americans today, what did they do all day long? They sat at a desk, or they were, very sedentary in their work, right? And so it's not, when we get to the end of the day, we're like, man, I'm so drained. It's not that we're physically drained. We are emotionally drained. And so we don't get that. You're like, yeah, I'm tired at the end of the day, but you didn't do much, right? We didn't exert our body. So.
Yep. And so I love this graphic. So this is an energy graphic. So 0 is absolutely no energy being expended, and 10 is on the high end, right? This is your workouts, okay? So there's sleep is the first third, the middle third is chronic stress, and the top third is exertion, okay? The argument that I would make is that we're totally getting rid of sleep and exertion. That we're living most of our life in this middle stage of just being chronically stressed, okay? And that we're not getting the sleep that we need, we're not exerting ourselves. And what I mean by exertion is that we're panting, that we're sweating, that we're moving, okay? So exercise, and I literally mean exercise, okay? So yeah, you maybe have used some stairs that day to get into your office, but I'm talking about actually going out and doing an exercise. That's what I mean by exertion. So we're totally eliminating this third, we're totally eliminating this third, the two most important aspects of our lifestyle, and we usually hang out all day in this area of chronic stress. And so sleep deprivation, okay, there's two components to this. The first one is that number one, we have unnatural cycles. Okay, what I mean by that is cortisol cycles get upset. Okay, so rather than cycling throughout the day, they stay high for a really long period of time, and then maybe they'll drop off a little bit, but by morning they're back up again. Okay, and so your body is literally living on high cortisol levels. It's literally just trying to survive. Okay, the other part of that is melatonin is downregulated. So when cortisol levels are high, you'll notice that in that circadian rhythm, and if you want to go back and look at it, you can and rewind it, you can actually look, melatonin is actually going to be lower. Well, melatonin is your sleep hormone. That's what puts you to sleep. So what happens is when melatonin is downregulated, you no longer have the sleep hormone, so a lot of you are probably taking some sort of melatonin supplement. Right? And I have patients that come in and they're like, well, I'm on melatonin, and the cool thing about it is my body creates it, so it's a natural supplement. Well, yeah, the problem is that number one, it's a synthetic version, okay? So it is still going to be different than the kind that your body makes. The other issue that we see is that when you're taking a melatonin supplement, your body downregulates it even more because your body perceives that, okay, there's melatonin present, I don't need to make any more. And so when you use that consistently over time for a year or two, your body, eventually when you want to go off of that melatonin supplement and try to get normal sleep all by yourself, your body is so used to that synthetic version of melatonin being there, it no longer is making melatonin like it's supposed to. So I hope that makes sense. That's a key indicator there. And then the other thing that will happen is insulin sensitivity will be downregulated. So what happens is when blood sugar, so what does insulin do? It removes blood sugar from your system. Well, what will happen is your blood sugar will become so high that your body makes more insulin, but it doesn't respond to it. So you become insulin sensitivity gets downregulated, so you actually become a fat storage machine, okay? And you start to put on belly fat, okay? The other thing that's a key indicator here is unnatural lighting. Okay? And what we mean by that is think about hibernation, right? If you were a bear, put yourself in the shoes of a bear, okay? When days get longer, what are you doing, right? Well, that's going to be summer, okay? So days are getting longer. Right now we're shooting this in June, so days are getting longer. We're nearing the longest day of the year, so our days are getting longer. Right, so we stay up longer, we forage, we hunt, right? We're storing calories for the winter that's coming up, the hibernation component. Well, the problem is that for most of us, we live as if we're in summer all year round, right? So what we're doing is we're actually extending days. So in the winter, rather than going to bed at 8, 8:30, 9 o'clock earlier on, whereas in the summer, you can get away with going to bed at 10:30 at night. Right? In the wintertime, your body expects you to go to sleep somewhere around 8 or 9 o'clock. What happens is that you extend that day. We have the artificial lights in our house. We have the TV screens, the tablets, the computers. And what happens is your body is being perceived, and physiologically it's changing, because what happens is you're extending those days out. So what we need to do is we need to start working in seasonal cycles as well and operating in that. So with the unnatural lighting, your leptin gets downregulated. So your appetite will go up, and ghrelin gets upregulated. So ghrelin is a hormone that when it's present, it just means that you're hungry. Okay, so your appetite will continue to go up. So you're eating more, which is why a lot of you are guilty of eating at 8 or 9 o'clock at night. This is one area that I'm guilty of. Okay, if there's one area that I fall short, my wife will tell you, all of a sudden she's laying in bed and all of a sudden she hears the refrigerator door opening because at 8 o'clock at night I'm going in to get something to eat. Okay, so I'm totally guilty in this area. The other thing is your cortisol levels are upregulated, so you actually start to crave carbs. Okay, so you'll actually start to, which is why a lot of us, it's a bowl of cereal at 8 o'clock at night, or it's a Pop-Tart, or something that's going to spike your insulin levels and not maintain that. And so what happens is insulin is upregulated and you start to store fat. So this is why a lot of people start to have that belly fat, is because hormonally their body it's so unnatural, their hormones are totally off.
Yeah. I think it's a great idea to give some time in between when you eat and when you rest too, because that'll throw your body into a whole different mode instead of sleeping. So I think that's a great point. And I think a lot of people, I'll drive this home, is they'll think about exercise and diet when they're trying to lose weight and have a good body composition, and they don't think about sleep. I mean, they could be doing all the exercise and all the perfect eating, but if they're sleep deprived, their hormone balance is going to be off, and there's nothing that they can do to change that besides just getting rest. So just keep that in mind.
And lack of sleep deprivation is going to affect the other two areas.
Yes.
Right? It's going to affect your nutrition, it's going to affect your exercise. So when I ask patients, I'm like, hey, how's your exercise going? They're like, oh, I'm way too tired to exercise. I'm like, okay, well, let's work on getting more sleep so that you can exercise. Or you can exercise, okay, which is going to exert you, and you're going to be more tired, so you're going to get better sleep, right? So these play off of each other. It's like a teeter-totter, right? And you need to find that fine balance, but they affect one another, right? Best practices.
Yeah, so these are some practical things. I mean, we've been a lot of conceptual. We want to get practical as well. So some things you can think of. Just use the circadian rhythm as a guide. Like in the summer months, the days are going to be longer, so you can stay up longer, and that's going to be more natural for your body. But when it gets to be winter, I mean, really, when it starts getting dark outside, really start preparing your body inside the house to go to bed. So the more you can stay with that rhythm and be consistent, your body likes to get up and go to bed at similar times. The more you can be in rhythm with your body, the better you're going to be sleeping. 8 to 9 hours is what you want to shoot for. There's certain physiological changes and benefits that you're going to have in the last probably 3 to 5 hours of sleep that you have, and so you really want to make sure that you're getting that 8 hours. I like this. Jeff Bezos, he's the CEO of Amazon. I always say this. He's like, I get 8 hours of sleep every single night. I don't miss it because I know I operate better when I've gotten a good night's sleep. There's things that your body does to rinse itself of things like proteins that cause Alzheimer's and all kinds of things that your body does in that full cycle of sleep that you just will miss out on if you're not getting that 8 hours. So really push yourself. And then one of the doctors that we know, he actually uses a Fitbit to actually track this. And the Fitbit, what it will do is it will monitor not only the quantity but also the quality of your sleep, and so you can kind of use that to keep yourself accountable. Some people really like that tool. So you want your bedroom to be like a cave, and what I mean by that is it should be dark, it should be cool, and it should be quiet. Okay, and so just take a second to evaluate your bedroom. And does it look like that? Is there a TV in there? What's a TV gonna do? It's gonna produce light, blue light, right? What does blue light do to your melatonin? It decreases it. So if some of you, you might be in the habit of watching TV, being on a tablet, being on a cell phone, sitting in bed. I would totally avoid that if you can. Okay, move away from that habit. That will help you. Even maybe some of you guys live in a residential area. There might be street lights. They may shine some light in around your curtains. I know we have some. They're not. They're more wooden curtains, if you will, and not cloth curtains. So at times light will creep in around the edges of the shades. And so you really want to pay attention to that. Any light at all can disturb your melatonin balance. even like an alarm clock or a night light or any artificial light, you really want to, hey, how can we get this out of this area, right? So it can be completely pitch dark. Your skin actually can absorb light, and that will affect your hormone balance, your ability to sleep. So just be mindful of that. And then the temperature, you want to be between 60 and 70 degrees most off. Your body just sleeps better at the cooler temperatures. So that can be a wrestle in some households. Different people have different preferences on temperature, but try to get in that 60 to 70 degree range if you can. The EFAST, I kind of mentioned that. It's just any electronics, just try to turn off about 90 minutes before you sleep. You'll be amazed at how much that's not just going to help your hormone balance and the light sensitivity, but also your brain. Your brain just needs to shut off before it goes to bed. It just needs to slow down, stop working and thinking so hard. So that can really help us if we just get off our cell phones. Just that's a rule in our house. We just get it off, right?
Grab a book, play some board games.
Sure, absolutely.
Do something.
Yep. Reduce alcohol and caffeine. So these things the way your body processes these chemicals will alter your sleep pattern. So if you're going to drink alcohol, try to drink it earlier in the day, because if it's trying to process and work through, breaking down alcohol when you're trying to sleep, that's going to, disrupt your sleeping pattern. And caffeine takes about 9 to 12 hours to completely get out of your system from when you drink it or consume it. So different foods can have caffeine, a lot of different beverages can have caffeine, so you really want to pay attention to when you're drinking that. So for the average person, maybe they're a slow, they're a person that breaks down caffeine slowly, and they're more in the 12-hour, maybe 14-hour range. If they drink caffeine, coffee, an energy drink at noon, that's still going to be in their system all the way until midnight. You think about 1, 2 in the morning. So really push yourself. You're going to have coffee, you're going to have that energy drink. Do it in the early morning hours if you have to do that, okay? But I try to stay away from caffeine completely. It's just, it's easier for me that way. And then household culture. It's helpful if you get everybody in the house with you on this. Yeah. That if they're on your team, instead of constantly fighting about it or having disagreements or struggles, right? So just trying to get everybody on the same page and saying, hey, this is our plan, this is our structure. No day's going to be perfect, but if everyone can kind of have the same goal and have the same, this is why we're doing this, that can really, really help too.
And this is an area that can be really challenging with little ones. So having a close to 3-year-old, close to 1-year-old at home, every night's different, and every night presents a different challenge. You can have the greatest of intentions, but it may not go perfect, right? And we realize that, but the goal is that mom and dad are on the same page and that everybody's calming down, we're turning off the technology. That's what we mean by household culture. We realize that it's not gonna be perfect, especially with little ones. I'm there, I know what that's like, but if the intentions are right, in most cases, you're gonna notice that the kids are going to like that rhythm and having that consistency as well.
And it really is possible. We live right next to each other, and there'll be times at 8 or 9 o'clock at night, I'll drive by his house and all the lights are off. Like, I can tell that they're chilling down. And so just setting that intention, working together, as a team, it's possible. So.
Yep.
Also, some other things to consider is have a routine. Like I mentioned earlier, your body works best on consistency. So having a very standard time that you go to bed, at a similar time that you wake up each day, your body's going to operate well that way and sleep better that way.
Just to throw something in there,
yep.
If you're wanting a routine, for those of you that are patients, here's an idea. Do some exercises, your active therapy exercises, do your blocking, and do your icing, okay? With no TV on. I think that's like a 45 minutes.
Yeah.
That's a great way to do it. So if you're looking for a routine, we've given you one, okay? So go ahead and do that.
Perfect. Yeah, at the same time that you brush your teeth every day, right? Like, it just, some things we just do, and once you get that habit down, it's easy. So avoid exercising and eating 2 hours before bed. Those things are going to ramp your body up in times. So you're going to make it hard to get to sleep and get into that nice rhythm. Sleep on your backs and read on your belly. So if you're sleeping on your back is a great way to support the nice natural curves in your spine and structure your spine. And if you're going to read, so many times I've seen, I've been guilty of this too myself at times where I'll be laying down and reading a book like this, and like look at my posture, right? Like it's just really bad. Or I'm on my cell phone that way. So if you need to read, just get on your belly and just have the book like this. That's a lot better for the curvatures, the natural curvatures in your spine. So that's just a good tip to follow there.
Awesome to teach kids that too.
Yep.
Just something that you can teach kids is sleep on your backs, read on your bellies. So if they're ever reading at home, have them read on their tummy, have them lay on the floor or carpet or something like that, and have them just read on their tummy, and then sleeping on your back is best. We're going to get into sleep positions a little bit more here in a little bit, but that's just a great thing to teach kids as well.
Yep. And trying to get your exercise in between 8 to 4. Just those, again, it's about working with the natural rhythms of your body, right? And so those hours are going to be just more naturally, your body's going to be more naturally ready to do that. And then once you get those in that hours, it's going to be more naturally ready to fall asleep when you want to fall asleep.
Cool. So now we're going to shift our focus a little bit from some practical tips into just talking clinically about the things that we most commonly see. And so there's really 3 different sleep issues that we see: sleep apnea, thoracic outlet syndrome, and restless leg syndrome. Okay, before we dive into the symptoms themselves, what's going on in the body with that, I first want to start here, and I know that we had talked about the nervous system at the very beginning, but I want you to understand and own the importance of your nervous system, because this is literally what controls the rhythms and flows of the day, but it also controls how your body functions and how it moves. So I tell patients, and I know this is an oversimplification, neurologically, your neurology is way more complex and different than this, but I think this is a good analogy for understanding how the nervous system and the spine relate, is that it's a lot like a fuse box, okay? And what I mean by that is everybody understands kind of how a fuse box works, in that there's bundles of wires that branch out at each level, and those wires go to different utilities of your house. So some will go to the TV, some will go to your lamp, some will go to the fan, some will go to the refrigerator or the toaster. You guys get the idea. Just like your nervous system. At each level of your spine, there's nerve roots that branch out, and they feed and they go to different organ systems in your body. And so what can happen is over time, these spinal joints or the vertebrae can actually be jarred out of a healthy position, and that'll create irritation on the nervous system. And so this is really getting at the heart of why we see some of these sleep issues, is neurologically and structurally, we see this change in the body where it shifts out of alignment. Okay, and what will happen is it creates this big S word called subluxation. Okay, and what happens with subluxation is there's a whole series of events, but the very first thing that will happen is the joint will misalign or it will become fixated. And that's typically, most people will think of things like traumas, car accidents, slips and falls, sports injuries. Everybody is aware of those things and how a subluxation can take place, but the main way that the joint gets jarred out of a healthy position is through lifestyle-induced issues, so what we call bad habits. So whether it's poor posture, like Dr. Andrew was talking about, or a very practical example is poor sleep position. So if you're somebody who kind of curls up to your pillow, that can shift things out of alignment as well. Well, that misalignment will damage the soft tissue, and it'll create inflammation or swelling into that area. And swelling will start to irritate those very delicate nerve roots that come off of the spinal cord, okay? And so nerve irritation or inflammation in that area will create a change in the muscle tissue, but it also creates pain. And so this is where a lot of the symptoms that we're going to talk about, the 2 out of the 3 symptoms that we're going to talk about, really originate with this nerve irritation, a muscle problem, and then the pain starts to set in. And when you experience pain, that'll actually create a production of stress hormones or cortisol. Okay? And long term, this will start to break down the joint, and a lot of things will start to happen. So subluxation is often the root cause of a lot of the sleeping issues clinically that we see in the office. So cortisol creates stress hormone production. Melatonin is downregulated, which will actually increase your blood pressure. So this is a whole concept called adaptive physiology. There's a lot more that goes along with it, but your blood pressure will actually spike. Think about when you're stressed. Somebody jumps out and they scare you, that's going to spike your blood pressure. Also, you have downregulated insulin sensitivity, so you become a fat storage machine. Weakness in connective tissue, so the tissue itself doesn't move and function how it's supposed to. I kind of like to say that muscles will kind of play tug of war with one another. So some will become tighter, some will become more relaxed or weak or atrophy in that area. Also, your immune system is downregulated. I mean, this is a whole body signals workshop that we're going to do in itself, but your immune system is downregulated. Let me give you an example of that. I remember going through grad school, and I would never get sick during finals week. Why? Because my body was high on cortisol. It was just running on cortisol. But when would I get sick? After final exams, right? And all of a sudden I go back home and my sinuses are draining and I'm all stuffed up, and it just doesn't seem like things are going to drain, and maybe I would get a headache along with that and have sinus issues, right? Why did it happen when my cortisol levels dropped off? Why? Because now all of a sudden my immune system's like, whoa, there's no cortisol present. My immune system gets downregulated. So a lot of you will notice that you're going to be really busy with work, and all of a sudden you go on vacation and you get sick on vacation, right? That sucks, right? So we don't want that. We want the normal flow of cortisol, and then inflammation and swelling, like I had mentioned with the subluxation. Okay. So sleep apnea.
Yep. And so this is like your chronic snorer, right? So I think there's probably one in every household that
Uncle
snores.
Johnny.
Yeah. So if you've known this person, you really know what I'm talking about. And so snoring, not getting enough air, and just having problems breathing when you're sleeping is what sleep apnea is, and it can be related to all this stuff that we're talking about. And so basically, just to kind of go through the anatomy with you. I mean, sometimes this can be a genetic thing. It can be like, hey, how I'm built type of thing, my structure. Some people have a deviated septum, and so sometimes this can be a structural problem. But a lot of times, even if your structure's not great, for kind of sleeping on, in certain positions, that there's things that you can do to lessen that problem. And so I'll kind of talk about what that means. But just basically, what happens is as the air goes through, it goes through some different structures to get there. And if your body's saying, laying in your back and kind of your head's tipped back slightly, that can be kind of a common position that people get into when they're sleeping on their back. That all of those structures are actually going to get closer together as you're in that position. And if you have, if your structure's off and they're already designed close together, and then you get in that position, they're going to even get more close, right? And so what's going to happen is as that air goes through those structures, it's going to start to vibrate back and forth as the air is trying to get through that tight space. And then that's going to make that noise, that snore, and it's going to cause the person even sometimes to stop breathing. And you might be like, "Whoa! Like, are they still alive?" Right? And then, they'll kind of get, they'll kind of startle themselves, and then they'll start, breathing. Maybe some people don't even wake up, but their body will like jump, and that's why that happens. And so, something that you can do to really help that is your lifestyle choices. There's certain things that we can do that create more inflammation in our body, and as we have inflammation, what happens to our tissues? Well, they swell. Like if you turn your ankle, right? What happens to that ankle? We have inflammation, which makes it swell. And so inflammation is a great thing. I don't want to get on that, but basically we want to do things that will decrease inflammation in our body, decrease the swelling of the tissues, and open up the space that our tissues have in between each other so that we can breathe properly. I know that there's a connection, and maybe you're going to be able to notice this with the people that snore, is if they're eating really healthy, they're getting exercise, they're doing all the things that will lower inflammation in their body, watch how that will affect the way they breathe at night. And then conversely, if they're drinking the beers and they're having the pizzas and they're doing not getting the exercise and doing the things that increase inflammation, watch that. Watch how that will. There's definitely a relationship there, and there's things that you can do even if you're designed that way that will decrease that problem for you.
And I'll even add to that is that it's not even when it comes to sleep apnea. If you just look at how people have lived their lifestyle, that's going to drive them more towards sleep apnea. So the person that drinks beers and eats pizza and eats grilled cheese sandwiches and stuff like that, that's pro-inflammatory, they're going to be the type of person that's more likely to experience sleep apnea. So we're not just talking about, how they, from day to day. Yeah, it can change, but we're literally talking about people that have sleep apnea versus people that don't have sleep apnea. Yes. It's typically the people with poor lifestyle that drive sleep apnea.
That's a great point.
You look at the demographic.
Exactly. You look at the people that are with heart disease and diabetes and overweight, obesity, and those watch how the sleep apnea in those demographics are going to increase. It's very tied together. That's a great point.
So the current option is to wear this, okay? And I think this was her honeymoon night. We're joking, but this isn't very fun, right? And so we need a different way. We need a better way. We need a more natural way of approaching this issue. And so clinically, what do we see there?
Yep. And I would say too, is that really addressing the problem, right? Same thing as taking the melatonin supplement. Is that really addressing the problem, or is that just enabling the problem to continue, right? Yep. So what are some things that we can do naturally with the body to help it function better, to address the root causes instead of just enabling the problem and treat the symptoms? So this is a common thing that we'll see just with the spine and nervous system. And if we have a misalignment or a subluxation irritating the nerves in certain places, that's going to affect the function that we see in certain parts of our body. And so if we have a subluxation, say in the upper neck, a lot of times we got to ask ourselves, well, those nerves, where do they go? They go back into our head, eyes, ears, nose, throat, and sinuses. And so if we have irritation up here with those nerves, guess how the structure and the function of things in our face, in our throat, in our head and neck are going to be? They're going to be less. And so a lot of times we see like sleeping problems. We have nerve irritation in the upper neck. And as you're going through your day, I want you to pay attention. When might there be some stress on your upper neck? Right? How many people are sitting and looking at a screen all the time, right? Do you think that could cause some stress in your upper neck? How many times will we have a weird night of sleep where we're just sleep in a wrong position? I mean, I'll have so many patients be like, I can't, it's so hard to control my body when I sleep, right? I just get in, and I agree, right? But that's natural, like that can happen sometimes. How many times have you slept wrong, right? How many times have you been looking at a phone, right? Any place you go these days, what are people doing? Right? We're so glued to our phones all the time. Do you think that could cause some stress in your upper neck? Absolutely. So there's tons of things that we can do that create that stress and that alter that function and create our body not to be able to breathe as well at night. Also, a really huge place of stress can be the low neck too. That can affect our throat, and that can affect this area of our neck into our shoulders, into our hands and arms, and that can also alter the way we breathe.
Yeah. So what we mean by chemical is that very often it's chemically driven, it's lifestyle driven, nutritional choices, exercise, sedentary versus exertion, those sorts of things will really drive this either up or down.
Your brainstem, actually, that part that comes right off the brain of your nervous system actually drives a lot of your vital functions, so your blood pressure, your breathing rate, your heart rate, those things is actually way up there. And so that's why a problem up here can affect the way you're breathing.
So the next one we're going to talk about is thoracic outlet syndrome. This is typically the person, and maybe it's you, it's typically the person that's tossing and turning at night, right? Like they just can't get comfortable, like their body's just moving and they're like, oh man, and they're tossing to the right and they're tossing to the left, right? Well, this is typically an indication of something called thoracic outlet syndrome. This is very much a physical issue. And what I mean by that is very often we'll notice areas either close to the spine or just off of the spine where either nerves, arteries, or veins are being compressed. And very commonly these people, when they lift their hands up, so if you're somebody who sleeps like this at night with your hands up and you wake up with numbness or tingling into your hands, typically that's going to be because you're compressing some sort of nerve or artery up in this area of the spine. Okay, so part of the reason we see this at C6 to T3, which is the upper part of your spine, this is where everybody says, I carry my stress there, right? It's kind of right across the shoulders. Well, you're not carrying any stress. There's no such thing as that. literally what's happened is you're probably subluxated, that joint's been jarred out of a healthy position, and it's literally creating nerve irritation or compression, and right at the base of the neck, kind of in the upper back area is very, very common where we'll see that. The other thing that's important to point out is right up in this area, it's a transition area in the spine. So you kind of have this forward curve in your neck and this backward curve in your low back. So this transition area is a really important area. And the neuroforamen, where the nerve comes off of your spinal cord, it typically gets smaller in that area. So there's more likely to be nerve irritation at that level. So that's kind of why you toss and turn from side to side. Yep. And then restless leg syndrome. So restless leg syndrome, if you know this person, or maybe it's you once again, this is the person where you just can't get to sleep because you're constantly just having to like move your body and move your legs, and you just can't get to sleep. So we'll so often see, like, we call this the creepy collie. It's a tingling sensation. You have this urge to move all the time, okay? And what we'll see with restless leg is it's typically a neurological issue that we see in the low back. Okay, so this is what we'll see from L4, L5, and then S1, S2, S3. S refers to your sacrum or your tailbone. So what's happening in this situation is very often there's going to be some sort of nerve compression down in the lower part of your spine. Well, these nerves in your low back go down your leg. Okay, and so that's why it's called restless leg syndrome. If you Google it, they'll tell you that it's genetic, right? Restless legs run in the family, right? No, what is it? It's nerve irritation. Let me give you an example of this, right? Let's just say you hit your thumb with a hammer, okay? And the first thing that you do, well, the second thing that you would do, the first thing you would do is you would probably cuss, right? The second thing you would do is you're going to shake your hand, right? Well, why do you shake your hand? Well, the reason for that is there's two different types of fibers in your body. There's slow twitch fibers and there's fast twitch fibers, right? So when you grab a hot pan, right, your body doesn't just immediately pull away. It takes a second, right? And then all of a sudden your body clicks and it goes, whoa, that's hot, and you pull it away, okay? Pain is a slow twitch fiber, okay, just like touching a hot pan. Well, proprioceptively, when you shake your hand like this, the reason you do this is because what your brain is saying is, my hand is here, now my hand is here, now my hand is here, now my hand is here. Okay, it's all about proprioception. Well, proprioception is a fast twitch fiber. Okay? And the reason we know this is because if you've ever been sitting in a chair before and all of a sudden it starts tilting back and you go, whoa, right? And you have these cat-like reflexes. You didn't even know you could move that fast, right? That's a fast twitch fiber. Okay? So proprioception is an important point in that, is that your body's proprioceptively just trying to move that area to get rid of the pain. Okay? So what your body's doing in restless leg syndrome is your body is constantly moving to try to get rid of the nerve irritation in the lower part of your spine. I hope that makes sense. I hope anything to add to that, Doc?
No,
so
nailed it.
cool. So that's kind of restless leg syndrome. It's the difference between proprioception and pain signals. Okay?
And so then we've got to ask, we got to cover this part of it because it's really, really important, and that's the idea of bad habits. And there's certain things, choices that we make, ways that we move, that will create irritation for our nervous system and create some of these problems that we talked about. And if we don't, tell you guys about this, it's easy to just recreate our problems, right? And no amount of adjusting a person, no amount of any treatment or intervention, if you will, is going to be effective if you just keep doing the things that create the problem, right? Yeah. So that's what a bad habit is. And so you can just take a look at these pictures, briefly, and I'm sure that you can find yourself. I've found myself in these pictures quite often in my life. I don't think we give our body credit for how much it goes through and how much it does for us and how much we put it through and what happens to it. And so it could be things like, sitting at a desk, for hours at a time. Could be the way that when we bend, right? A lot of times we don't use our knees and our hips, even though we know we need to. We get lazy, right? Or we'll be get lazy. We don't want to move our feet. We'll bend and twist in a certain way. Sleeping, right? A lot of times we're not sleeping in a great position. And so just a lot of, even good things like biking, right? Look at the guy's spine, right? It's just what's happening to that, on phones. A lot of us use phones and computers all the time. So wallet in the back pocket, that's a classic one for guys. say we took that wallet, maybe it's a couple inches thick, and we taped it on the bottom of their foot and had them walk around like that all day, like what would that do to their hips, right, and their back, right? We would never do that, but for some reason we're okay with sitting on 2 inches under one cheek instead of the other and think that it's not going to create a problem, right?
I just had a guy the other day say, I flip back and forth. Sometimes it's in my right pocket, sometimes, so I think I'm offsetting it. It doesn't work that way, okay? The body compensates.
Yeah. High heels, purses for ladies. Sometimes we pick up purses with patients and they're like 30 pounds, and it's like, 30 pounds on one side of your body is going to create a problem. So it's just little things that probably won't kill you one time, but if they happen over and over and over and over for years, they will start to break you down. Yeah. So be aware of these things.
And I think the important thing is our goal with this, in terms of just pointing these things out, is to take them from a subconscious level, because you guys, you instinctively do these things, right? And so our hope is to take it to like, okay, I'm more aware of my body. It's more conscious of like, okay, what type of positions am I putting my body into?
Mm-hmm. And so just to give you an idea, one aspect of this, like a bad habit, is our posture, and how posture will change everything about your body as in terms of your longevity and just your ability to be healthy over time, and how long you're going to live, how well you're going to live. And so just to give you an instance, I mean, just look at this progression. Like, we want to see natural curves. We want to see our posture in certain places, our head over our spine. And if our head's over our spine, it's typically about 12 to 15 pounds is how much my head weighs and your head weighs. But you can see physics, principles of physics work on our body, right? And you can see how that's going to change the forces of that gravity on our head over time. If it's about every inch that it comes forward, our head is going to get actually heavier, that the further our head comes forward. Even though it weighs the same, the leverage is going to be different on our spine. If you just think about this, I mean, if you were carrying like a dumbbell above your head, if it was straight over your body and you locked out your arms, you could hold that for a while, right? If you were walking around like this. But try moving that dumbbell about 3 inches forward. What's that going to do? How's that going to feel, right? That's going to get exponentially harder to carry, right? And you're going to start to feel muscles start to light up that like you didn't have to even use in that straight above position. So I think you can kind of get that idea and just how important that structure in our posture is over time, and just the things that we do on a daily basis that bring our posture in a bad place. So any other thoughts on that, Doc?
No, I think one of the things, the last thing a woman wants to hear is, yeah, you got a humpback, yes. Right? Or, you tell a lady, yeah, you're a bit kyphotic, yes. Right? Well, what does that mean? Well, you have a humpback. No, right? Yes. No, I don't, right? So these are the things that just posture is such a big part of it. I mean, we talk about, by the way, in kids, we talk about something called tech neck, of just like spending so much time on technology that literally we can diagnose a teenager with something called tech neck. That if their issues that are going on with their spine are related to technology, there's actually a diagnosis code for that, which is incredible. I mean, this is stuff that our ancestors never dealt with. It's totally unnatural, which is what we continue to get back to. Yep. So we wanted to finish up just with some frequently asked questions around sleep. There's probably a million different questions, right, around sleep, and we hope you guys ask those to us because we'd love to answer them. But these are just a few of the most common ones. So the first one is I'm somebody who gets 8 hours of sleep at night, but it's often interrupted sleep. Is that still good enough? Well, there's a really important thing, and Dr. Andrew mentioned it briefly, but I'm going to dive a little bit deeper in. He mentioned something called non-REM sleep. This is what's considered your deepest sleep. It's what I like to call reparative sleep. It's restorative sleep. This is where your body repairs itself. So we have a saying in the office that the only time your body heals is when?
It's sleeping.
When it's sleeping. Okay, so the non-REM sleep is the reparative component, but there's a compounding effect of non-REM sleep. What I mean by that is that the longer that you stay asleep, the more non-REM sleep that you're going to get into and the deeper sleep that you're going to get into. So if you're somebody who wakes up every hour or 45 minutes with a situation like thoracic outlet syndrome or restless leg syndrome, you're not going to get the reparative and restorative sleep, so you're going to be fatigued by the end of the day. I mean, for sure, or middle of the day. you'll be fatigued. So it's the compounding effect, just like compounding effect of interest, right? We know that that's a powerful tool in terms of wealth building. The same thing is true with our health, is that the compounding effect of non-REM sleep is really important, that the longer that you can link hours of sleep together, the more repair you're going to get. So 8 hours of off and on sleep is not as good as 8 hours of continuous sleep. The other one, I'm going to ask you this one, Doc, but my body only requires 5 hours of sleep, right? I've heard this one before.
Yes. So a lot of people, they've actually conditioned their body out of need or out of just personal preference and they can run on 5 hours of sleep. And I think the tendency is, I noticed this throughout, a lot of patients, is their body will drift away from normal so slowly that they don't even realize it's not normal anymore. Like I'll have a patient say, well, I do get headaches, but it's just my normal headache. Like it's just the way it's been, and that's normal for me. And I'm like, wait a minute, is having a headache for a human being ever supposed to be normal? No. Right? That's not, if we took a person that's healthy, would we describe them as having a headache all the time? No. So I would caution this person to saying, is that the way your body's naturally designed, or is that the way you've conditioned it? Is that the habit that you've had for a long time? And our bodies are really great at adapting, absolutely. And so our bodies can adapt to a lot, but what is that habit going to create over time? I mean, there's no doubt about it that you're going to be losing that time to repair and recover, and when you're getting less sleep, it is.
It is what it is, right?
That's the reality of it.
Yeah.
And so, how is that going to compound over time? The other principle here is, a lot of times there might be a problem in the crisis. Does the crisis happen a lot of times in a chronic issue at that time of the problem, or does it happen years later? Right? With a heart disease, does that person get heart disease in 1 minute, or do they get heart disease over a course of years, right? So the same thing can happen with this, like a chronically sleep deprived person, they're going to develop more disease than a person that's getting sleep. It is a fact, okay? So I would challenge that person and just encourage them to think about, hey, how could they retrain their body, right? How could they make time to let their body get back to that normal place where they're getting more sleep and get into a new habit, get into a new rhythm.
Cool. Can you talk a little about sleep positions?
Yeah.
Best sleep positions.
Yeah. So I would say the best two positions would be on your back or your side. I'm personally a side sleeper, and so I like, if you're on your side, what I like to do is, say I'm sleeping on this side, I like to have a pillow that's at least the width of my shoulder, or pretty close to that, so that it keeps my neck and my head in neutral over my nose, over my sternum and my spine when I'm sleeping. I also like to have a pillow underneath my top arm. What that does is it keeps my body from rotating when I sleep, and it also takes the pressure off the bottom arm. A lot of times when people sleep on their side, they just get shoulder problems, right? Because that pressure all on one arm. So that can help you a lot too if you put a pillow underneath your top arm to take that pressure off. And then also, a pillow in between your knees and your ankles is a great idea. What that does is it helps keep your pelvis balanced and level, and it helps keep your pelvis from rotating when you're sleeping. Because what's going to happen is, if you don't have something to keep your legs shoulder width apart, what's going to happen is they're going to get close together, right? And one leg's going to have to go forward or backward, or it's just going to be a little bit shorter just because of the angle. One side's flat, one side's got to be angled, and that's going to mess with your pelvis and your low back over time. So that's a good way to sleep on your side. If you're sleeping on your back, you just want to have a pillow that supports your neck and your head in neutral. And what that means is your head and your ear should be over your shoulders when you sleep on your back. It shouldn't be too less of a pillow so that your head is like this, an extension too much. Shouldn't be too fat or too fluffy of a pillow that pushes your head like this, so you're sleeping like this all night. So oftentimes, if you want to put pillows underneath your knees, just to get a little bit of knee flexion when you're on your back, that can take pressure off your low back too. But I would say those two, what you want to avoid is sleeping on your front, your stomach. And because what you're going to have to do when you're sleeping on your stomach, what do you have to do with your head to breathe? You're going to have to turn it to one side. And that's going to be just a torque on your spine for long periods of time. That's just not going to be good for any part of your spine or your nervous system.
So now I want to talk a little bit about mattresses and pillows. There are probably, dozens of different mattresses that are probably great. In general, the thing that we like to say is moderate firm to firm, okay, in terms of your mattress. So let's focus on mattress first. Moderate firm to firm is best. So obviously, you know, we don't want you sleeping on a hardwood floor, right? So we want a little bit of a give there, especially if you're a side sleeper. Okay, you're probably more moderate than firm, but somewhere in that ballpark. Now, in terms of brands of mattress, there's probably a lot of those out there that we could recommend, but we only recommend ones that we have experience with. So there's two of them that we talk about in the office, Classic Brands and Level Sleep. Classic Brands you can find out on Amazon. They have an 8-inch, 12-inch, and 14-inch mattress. That's the one that my wife and I have. That's also the one that we have for our little guy, Jax. He'll be 3 coming up. He's had that for about 10 months now. So we want our kids to be getting good rest too. So just be aware of that what mattress your kids are sleeping on. So probably not something you typically think about, but it's important. And so Classic Brands, I think if you buy the king size, the one that we bought for the mattress was like $275. So for a lot of you that have spent $2,000, $3,000, and I've even heard of upwards of $4,000 on a mattress, you don't need to spend that much. I mean, once again, neither of these mattresses are organic or made out of bamboo, I don't think. I mean, so if you're wanting something particular like that, maybe we need to look into something like that. But this is a great mattress that you can do on a budget. It's what I sleep on. It's great. We love it. The other one is Level Sleep. We also have a pillow in the office that we sell. I'm going to talk about that here in a second. That's through Level Sleep. They have a great mattress as well that we recommend. So either one of those. I have patients that come in and, what do you think about this one? I can look at the mattress, but I've never experienced it, so it's hard for me to exactly recommend that. But those are two that you can look into there. The other thing is with mattresses, 8 years or older, you need to get rid of it. Or even if it's 5 years and you're starting to notice some dips in it, right? Like it's W-shaped because there's 2 of you laying in bed, or it's U-shaped because it's just you laying in bed. Okay, if you're noticing that it's starting to look like a taco shell, you need to get a new mattress. Okay, so the issue is that too oftentimes we buy too soft of mattresses and then we keep them for too long. Okay, so Dr. Andrew had a patient here just a few weeks ago. He's owned a mattress for 2 or 3 years. He spent $4,000 on it. He came in all flared up, which wasn't normal for him. We were like, you know, Dr. Andrew's like, well, there's something going on here. So he recommended that for 2 nights, he sleep on a carpeted floor. Because what that would tell us is, okay, if his mattress isn't firm enough, he's gonna wake up the next morning feeling really good. And if he's still sore when he wakes up in the morning, well, then it's probably not his mattress. So a good way to test your mattress is sleep on the floor, on a carpeted floor for a couple of nights. If you wake up feeling better in the morning, it's probably the mattress, and you need to look at something different. And he came back 2 days later. It was his $4,000 mattress that he bought 2 years ago. So what he did is he actually went out, he bought the Classic Brands one, and I think he's really liking it.
He's given me some great feedback on it.
So it's been awesome. And then in terms of supportive pillows, obviously, right, the My Pillow is a common one. What we recommend is just find a pillow that keeps your spine in neutral, that works with the sleep position that you sleep in. Okay, so we have a proper pillow in the office. We also have one called a Level Sleep pillow. And no, there's not a pillow that's going to be good for stomach sleepers. So if you're a stomach sleeper, you need to work on sleeping in a different position. Okay, it's as simple as that. There's no mattress, there's no pillow that's going to correct or fix or get you comfortable enough for stomach sleeping. It doesn't work that way. But we do have the proper pillow, the Level Sleep pillow. Those are in the office. But the biggest thing is when you're out looking for a pillow, make sure it keeps your head in neutral from the side. Your nose between your toes, nose over sternum, and from the side it keeps your ear over your shoulder. So that's what we recommend with regards to those. If you guys have any other questions, please reach out to us. Anything to add, Doc?
I think that's
cool.
Good.
This has been fun.
Yeah.
So that's kind of sleep issues. Always reach out to us if you have any questions. We would love to do that. And we look forward to next month's workshop. We haven't decided yet, but if you have any recommendations, throw them out there for us. But it was good sharing with you. Take care.